A couple of announcements to make. Good morning, Facebook. It looks like we may actually be on LinkedIn now, YouTube, Twitter, IG, wherever you may be. Welcome to Hanging with Dr. Cooper. Summer vacation is over. Not really. I'm actually going on vacation in a couple of weeks. I want to thank you all for once again gracing me and my guests with your presence today on Hanging with Dr. Cooper. We have a really exciting show and a lot of information for you this morning. I hope everybody is doing well. I see y'all are checking in now. I got a couple people out there live so far. I really want to thank you once again for spending time with me and really taking advantage of some of our wonderful guests to talk about some very, very important subjects related to your health. And today my guest is Dr. SAMIRA BROWN. She is a pediatrician with Piedmont Physicians Pediatrics in Covington, Georgia. And most of you all know that that's just a suburb of Atlanta. And she is here today to discuss COVID-19, children, and returning to school. There's a lot there. And in some of my social media posts earlier this week, SAMIRA, I said, I'm not sure we're going to get through all of this because this is a lot to wrap our head around in an hour. So I'm going to put you on point right now and say, if we don't get through, can you come back and grace us with your presence again if we have some unanswered questions. Good morning there, Lucretia Cooper, my cousin, always on point and checking in. We appreciate you. So my guest, Dr. SAMIRA BROWN. SAMIRA, tell us about yourself. Where are you from? And tell us what got you going into medicine and just give us a little bit of your background.
Yeah, well, thank you so much for having me. I am a pediatrician here in Atlanta, and I am originally from New England. So I grew up half in Connecticut, half in Massachusetts. And really since the beginning, like when I was really young, my parents definitely instilled in me that the only thing that I really had to do was to give back to the world, give back to your community. And so we really had license to do anything that we wanted. And my mother was in early childhood education, and I used to see her work with children and families and go to work with her. And then I really got into science and actually had a Black woman as my pediatrician. And so I really decided that that was what I wanted to do really early, around 8th grade. And I was very driven. I remember as a freshman in high school, I was looking at the top medical schools, and my high school counselor was like, we need to look for a college first. And I was very much like, no, I know exactly what I want to do. And so I knew very early that I wanted to do pediatrics. So, and even in high school, I did a lot of research programs at Mass General, really, trying to get my foot in the door as early as I could. So I absolutely love what I do. I love working with families and seeing kids, grow up with me.
That's fantastic. So that sort of upbringing and mom being in early childhood development and education and care for children had a major influence on you.
Absolutely. Yeah. And she worked with a lot of, families who didn't necessarily have good resources, also kids who had developmental delays. And so it was really powerful to see how she could make an impact, not only in the family's life, but also in that child, to get them services and to get them services early, which makes a big difference if kids are caught up from their delays by the time they start school.
Mm-hmm. I always find it remarkable and really it's not remarkable, but intriguing though, when I have 4 children, none are doctors. But then you see families where there are doctors, and then you see some that are in the absolute same specialty. And I was like, now, is that your passion, or is that mom or dad's passion? And what I find very, very often when I see that, even like athletes who, I think about Ken Griffey and his dad. No, that was my passion too. But it's amazing how, my dad didn't live vicariously through me and made me go swing the baseball bat. Mom didn't make me love children. It just happened sort of that. It's always very intriguing, but it turns out that that's really their passion. That's what they really love to do. And it's really truly a remarkable thing to see that when family members sort of fall into the same sort of areas as they go through their life. So now you went to some heavy hitter places for your education, undergrad. Places I couldn't get into, SAMIRA. Tell us about that a little bit.
Listen, you have to let them say no. So I always tell people, always apply. If that's where you want to go, definitely
Hmm.
always apply.
Yeah.
I think, for me, because I knew I wanted to go into medical school, my dad was actually on the plane with a Xavier, alum. And they said, if your daughter wants to be a doctor, she should go to Xavier. And
Yeah.
they put me on a mailing list and started recruiting me. And it was very quick message. If you want to go to medical school, you come to Xavier because we know
Hmm.
how to get you in. And
Hmm.
I went down there, I visited, I loved it. I loved New Orleans. It was,
Hmm.
an extremely good school. They prepared me very well. And even when I was younger, I remember my mom took us on a tour. We went to Harvard on a tour, on a college tour, and it was
Hmm.
obviously easy because we were right there in Massachusetts. And even though I don't remember it, she said that while I was there, I said, I'm going to come here someday. Like, this is
Wow.
going to be my college. So
Wow.
I think too, those early, kind of impacts of, showing kids what is out there and what you can do.
Hmm.
And Xavier prepared me very well. And, I loved my time at Harvard. And same thing when I was in college, I actually did summer programs at
Hmm.
the medical school, at their School of Public Health. I also did one at Yale. So I definitely always knew that as long as you can try to get your foot in the door where someone knows you, can write a letter of recommendation, it just helps that process along if that's really what you want to do.
Yeah, and I want to go back to one thing you said about the alumni. Your dad was on a plane with somebody from the Xavier alumni. That's important, and I know it goes without saying. I know you're involved with Xavier alumni, but that school, Dillard, and a number of HBCUs in the South are really like just machines for providing African Americans in particular and people of color and women into healthcare professions. And that's the way it happens. It's amazing. You said, well, your dad was on a plane, said, hey, she wants to go to med school. She needs to be talking about going here. Guess why? Because they foster development of people who are going to be successful going to Harvard and Hopkins and Emory and places like that with the really, really big names. So extremely important there to just point that out to people. That's very important. Even it doesn't matter where you went to school or even medical school or a professional school, whatever, you need to stay connected because you will be the catalyst for getting someone to go there and continue the pipeline of good people coming out to serve our communities. So Samir, how did you end up in Atlanta?
So I have some family here. You know how they
Oh,
say
yeah.
everybody has a cousin in Atlanta. I have about
Okay.
10 cousins here
Wow.
in Atlanta.
Everybody's got somebody in it. Everybody's got somebody in Atlanta. And
Absolutely. Look,
yeah, if
north,
not,
south,
yeah,
east, west.
yeah.
So for me, it was really about getting closer, to my
Uh,
family. And so it's been wonderful. I've been here for about 2 years. Prior to that, I was in New Orleans for about 10 years. So I still feel like that is home as well.
mhm, uh-huh.
And so I've really enjoyed my time here so far in Atlanta.
Well, good. Well, welcome. We're glad you are here. I'm gonna pause for the cause. I want to give a few shout outs. I said hello to my cousins out there with that last name Cooper and also Brown. Pam, I see you. My wife's on here, Sandy Peterson Cooper. How are you doing this morning? Ernest Cooper, how you doing? Manitra Beetleman, how are you? Welcome. Thank you for checking in. Marcello, Ikra, checking in from Islamabad, Pakistan. Candy, how you doing? Hillary, I see you out there under your alias. And with Dr. Bonds, thank you so much. We're talking to my guest this morning, Dr. Samira Brown, and she's a pediatrician, top doc on Hanging with Dr. Cooper, and she's talking about herself right now. As you all know, I don't read long bios; those are great advertisements, but we all have a story, and it's better told by ourselves. And so that's what we were doing here this morning. But now we're getting ready to move on to what you all really came for. Woo, Samira. Samira. This
Listen, we're
COVID.
all in this together. We're all
Yes,
in
we are. This COVID, I follow the blogs and I get the email blasts from the various hospitals in which I work, and I get, all of this information that comes my way. And oh wow, I am now live on LinkedIn. I just noticed that I got my LinkedIn crew checking in. Thank you all so much. Wow, I've had that request out there for quite a while. So I'm sorry about the interruption, Samir. But COVID, I was telling my wife yesterday. I was explaining to her that we are really in a remarkable time with this virus, not just for the devastating impact on our society, but it's really remarkable to watch how a living biological thing sort of evolves. I mean, literally right in front of us. Because if you think about where this came from, and then it jumped over to humans, and it's a novel thing now. And all of a sudden now, this thing is literally fighting for its life. I'm talking about COVID, to stay
Mhm.
alive. And every one of these mutations is really, and I'm not an epidemiologist, virologist, or anything, but I know how this stuff works. You and I both know we had to learn this in medical school.
Absolutely.
This virus is trying to survive. And that's why, I was just reading something the CDC put out the other day about now that the viral load, even in vaccinated people, seems to be even higher than the viral load they saw. I think this, if I'm quoting this correctly, than we saw with the first iteration of the COVID virus. This is just remarkable. So let's just tell me your thoughts on COVID in general, and then we'll come around to sort of getting and honing it into or down to your area of expertise, which is pediatrics. So tell me your thoughts on this whole thing.
Yeah, it is interesting because I think this is the first time that we've seen really here in this country, right, in a long time, right, that we have a respiratory virus that's this contagious. And we're at an extremely different point in this pandemic than we have been. And you're right, we know that this is what viruses do. They mutate, and most of the mutations are, we're never even going to hear about, right? But then the ones that are advantageous to the virus and take over, like this Delta variant, are very concerning. So just exactly what you were saying, there was an article that came out that when they're studying in other countries, the viral load in those who are infected is 1,000 times higher than the initial strain that we saw. So that's what makes it so contagious. And that's why even vaccinated individuals can still spread, the Delta variant. So it's really important, I think, for us to get the message out there so that people know how to stay safe and how not to infect others as well.
Yeah. So, it's very interesting to me, and I won't even get into politics of talking about viruses, but you find so many things from a health perspective, you and I being physicians, that people just sort of glaze over. And so I challenged someone one day and actually this was a healthcare person in a hospital and a nurse who's taking care of patients with COVID.
Mm-hmm.
And she just happened to be drinking one of those energy drinks. I won't put a name on it because one day they may want to sponsor me. But one of these energy drinks, and I just picked it up and I said, so-and-so, tell me what's in that drink that you're drinking. And I said, so we started, I said, she could name most of them, some of them I couldn't even really pronounce. And I said, so let me ask you a question. What does any one of those things, what impact does that have on your health today or in the future? Do you know? And I can tell you right now, there's one thing in there that I can tell you is not good for you, and it's a ton of sugar and caffeine. Okay. But then sort of say, okay, well, what's your problem with the vaccine when you put things in your mouth every single day and you have chemicals and you have absolutely no idea what the impact of that is, except it made you feel good right then and there. But then you contrast that with the data that we have for COVID, knowing that even if you get it, and I just watched this is less than 0.00, some ridiculous 0.0001, but even if you get COVID with being vaccinated, it's almost nil that you're going to die. And don't talk to me. Somebody says, oh, that's 544 people. Well, let me just tell you something. 600 million plus have had this vaccine. So get out of here. So tell me how you feel about that when you just think about, the psychology of how people process those things.
I think it's a little different for us in pediatrics because we have dealt with vaccine hesitancy for a really long time, really my entire career as a pediatrician. So I think too, I'm very used to having these conversations. And I think a lot of it comes down to trust, right? So we have to really develop a relationship with our families so that they trust us. And sometimes it's not going to be in that first conversation. Sometimes it is literally just talking about some misinformation that they've gotten and being able to show them the proof, right? And that day they're going to get vaccinated. Sometimes it's literally years of these conversations that you have with families so that they understand. And sometimes I think it really has to be case by case. Sometimes they know someone, right, who may have had a bad outcome. We all know about, anecdotal, stories, right? But I think, you really have to go into the detail of why that we know that it's safe, and really also challenge, when it is something that's just completely false, not based in medicine, and really give them good resources to go to. Because a lot of times they want to go and read it for themselves, which is fantastic because you want them to be advocates for themselves and for their children.
Yeah, I've seen some really good stories. I read one on I think it was LinkedIn yesterday. Orthopedic surgeon, I think it was, who posted his conversation with a patient and how he really reversed that in a really very professionally done way. But it really boiled down to, well, you don't trust the people who've been vaccinated, who've been taking care of you and putting rods and pins in your hip, and yet. You won't go and get the same vaccine that we've gotten to protect you. I want to pause for the calls here real quick, and I really want to say hello. This is the first time I've been on LinkedIn Live. Thank you, LinkedIn, for allowing Coop to come and hang out on your platform. I see a lot of people checking in over there, and I really appreciate that. William Lampley, I see a bunch of new faces. Marcello Arcelay, make sure I get that right. If not, pardon me, charge it up to my head, not my heart. Roland Jackson, Kevin Woods, Dr. Woods saying hello, Samira. Our good buddy and friend. So my guest is Dr. Samira Brown, and she's a top doc, hanging with Dr. Cooper, talking about, and pediatrician, and she's talking about COVID-19. And now we're going to get into the meat of this thing, taking care of our babies. So tell us about COVID and kids, Samira. What have you seen, and what in the past, and what's evolving? Pre-vaccine, now with the vaccine, what's been your experience with this in taking care of children?
Yeah, I think, from our perspective as pediatricians, we always want to stand up on the safest side for children. And unfortunately, in the beginning of the pandemic, it was thought that maybe kids didn't get it, maybe they didn't spread it. And we now know all of that is not the case. So they absolutely can get COVID. They absolutely can spread it. And they also need to be protected. There have been over 4 million children who have had COVID already in the United States. And in just the past week, pediatric cases alone are up 34% due to the highly contagious Delta variant. So now really is the time to tighten back down and make sure that we're protecting kids. So certainly acute COVID can be very serious in children, and they can be hospitalized, even need the intensive care unit. But by and large, most kids who have COVID acutely are going to have no symptoms at all or very mild symptoms, right? And so if there's any thought that you've been exposed or your child is getting sick, you definitely want to come in and get tested. And the best time to get tested if you've been exposed and have no symptoms at all is about 4 to 5 days after that exposure. But of course, you need to make sure that you're staying at home and not exposing anybody else at that time, even if you have no symptoms. The other part that we worry about for kids is what we call post-acute sequelae of COVID. So weeks to months later, you can have a very serious but rare complication that's an inflammatory disease called MIS-C, or multi-inflammatory syndrome, in children. And unfortunately, these kids get very, very sick. 6 to 7 of those children end up in the hospital in the ICU. And 1 to 2 out of 100 of children who have this don't survive it. Because what we have is, by and large, a symptomatic treatment. The other piece that we also are studying right now is long haul or long COVID, which is also part of this post-acute sequelae. And we don't know, all the answers, and we're certainly studying it. You probably saw that the NIH has several studies that they're funding currently involving children, just so we can understand more about these chronic symptoms, whether it's sleep problems, chronic fatigue, whether it's brain fog. So it's really important that everyone understand that if your child is having persistent symptoms after COVID, certainly longer than a month, you want to think about long COVID and come in and get and see your pediatrician.
Yeah. So Samir, you mentioned something that's new information to me. That's this inflammatory syndrome in multi-organ inflammatory syndrome in children, and 6 to 7% who actually acquire it end up in the intensive care unit. Is that correct?
Mhm.
What is the time? What is the time? Tell us a little bit more about that, and what's the timing of that?
So typically it's a few weeks after infection.
Hmm.
And it's also important for families to know that it's not only kids who had symptomatic COVID. So some of these children come in and their families had no idea that they'd ever been infected. And so it can be symptomatic or asymptomatic COVID that then weeks later will present. And typically it's very high fevers. And these kids come in and they look very sick. So it's not that it's subtle, but you always want to make sure that, for the fellow pediatricians out there, ER docs, you always want to make sure that it's on your differential, that you think about it in kids who are having high persistent fevers, that you need to work them up for MIS-C. It's thought to be similar to a Kawasaki type of disease where you can get inflammation really of every single organ in your body. But these kids can get very sick very fast.
Wow. So now I think we have two of our vaccines, if not all three. You can update me, please, on the EUA for children down to, I think, of age of 12. Is that correct?
So it's actually only Pfizer who has an
Only
EUA
Pfizer? Okay, it's just one.
12.
Okay.
Yeah. And so it certainly is a sigh of relief to us as pediatricians because, when we vaccinate, we know that we're saving lives. Right. And so Pfizer certainly for 12 and up. And so the next age group will be 5 to 11. And we're hoping that we're going to see some safety data from Pfizer sometime in September or October. And then, of course, it takes a few more weeks, for that to be, evaluated to see if that will get approved down to that age. But they also have studies going on all the way down to 6 months. And that is in both companies, both Pfizer and Moderna, both have pediatric studies. And you've probably seen recently the FDA has asked them to have at least 3,000 children in that 5 to 11 age group, since that's going to be presented next. And they definitely feel like they're going to be able to do that. So hopefully we'll have vaccines for children even younger very soon.
Got it. Yeah. So that was Jason Edwards. Thank you for that question regarding the status. And Dr. Brown just gave us that update on what's happening with the vaccines. So what has been your experience? You and I discussed pre-show that pediatricians have dealt with the issue of vaccine hesitancy for a number of years because kids get vaccinated. So tell us about, your experience thus far in the era of COVID vaccines and vaccine hesitancy, and what are you hearing from your parents of your patients?
I think it's almost in thirds. So, a third have come in and they already had it. They already got it. We high five and, we applaud, and tell them to spread the word, right?
Excellent.
We're also, as pediatricians, how we do, we're also going to ask mom, dad, grandma, auntie, are you vaccinated? Right? Are your siblings, maybe you're 5, but you have a sibling who's 13, right? And please spread the word, right? And what complications, are you at high risk for COVID? So we want to make sure that they're always really mindful of what their individual family risk is, right? And then you have some who are on the fence and really want to have, a conversation, about it. And then you have a third who are really just not ready to talk about it at all. And so I always ask permission because I think, it's a good way to start a conversation. And I say, do you mind if I give you, the information that I know about this vaccine? And this is what I would recommend to you if you're not going to get vaccinated, right? These are the things I want you to read and think about. And then this is how to try to keep your family safe. This is what you need to look for to come in to see me if, your child has COVID. And of course, that advice goes out to everybody, vaccinated or unvaccinated.
Well, I'm gonna pause for the cause one more time. Thank you all for hanging with Dr. Cooper. We have a lot of new faces and guests on here. I really appreciate it, Rhonda. Dr. Smith is with us, and Annette Marshall. Thank you, Annette, for joining us as well, and presenting your questions and comments in the comment box. We are going back to school, and hey, that's creating a lot of anxiety for a lot of people for a number of reasons. So indoor places, we've already been going to stores. Everybody's been outside now at the pool and able to be out. So all those droplets can disperse in a much larger volume of distribution, if you will. But now we're coming inside. So let's get to it. Indoor places and kids and protecting them, and what are we hearing? What are we saying? What should we be advising? What should parents be doing regarding that?
Yeah, and I mean, we know as pediatricians that school is so important for kids to experience, and that them coming back into school is really important, especially kids who had a lot of academic losses last year, because a lot of kids were virtual and didn't necessarily do well with that. So we're really hoping that kids can be in classrooms, during this pandemic, and that we can do it safer. And in part because studies were done last year to show what are proven strategic methods that you can use to keep kids in the classroom, right? And so certainly we know that all kids 2 years and up, it's recommended by the American Academy of Pediatrics and by the CDC now, thankfully, that everyone needs to be masked, whether they're vaccinated or not. Teachers, children, teenagers, everyone needs to have a mask on when they're inside. And when we say masking, we do also mean masking consistently and correctly. So not under the nose, not under the chin, not on your ear, right? So really helping kids start to learn how to do it, get back into the habit. And also we want to make sure that those who are 12 and up in that school system are vaccinated. So really asking your schools about, are your teachers getting vaccinated? Are they being encouraged? The administration, the staff. So you really want everyone to be vaccinated who's eligible, to make it even safer, and especially to protect children who are under 12, who are all going to be unvaccinated and at more risk. So this is a different point in terms of going back to school because the Delta variant is much more contagious. And then there are proven methods, right? So we know that they need to space out when they're indoors. We know that the school should have looked at what kind of ventilation system and really maximizing that outdoor time, even opening the windows and making sure that kids are in cohorts, right? So if you do have an outbreak, you have a smaller amount of children that have been exposed. So there are really proven methods, right? Hand washing, cleaning those high touch surfaces. All of those combined are how to make it the safest to be back inside for school.
Yeah, we talked earlier about how easily transmissible the Delta variant is. And so we have parents who have children that are below that vaccination age recommendation threshold. And although they've been vaccinated, and here's sort of the irony of it, is that even adults who've been vaccinated and still be transmitting it. So how do we reconcile or deal with that issue? Because now even some of our adults who are educators, they're going to be going into the school system. So I think you probably already hit on it, but just kind of, that's a little bit of anxiety that's provoked in people when they think that, hey, I'm vaccinated, I could still potentially be spreading this, and particularly to my young child who is not yet vaccinated.
And we do hear this on a pretty regular basis. So folks will say, I couldn't have COVID because I'm vaccinated, right? So we know that it's a much lower risk if you're vaccinated, whether or not you're going to get COVID. Your chances of having symptomatic COVID are much lower. And then, as you talked about earlier, Coop, your chances of having severe disease and being hospitalized, that's a 20-fold reduction risk, right, if you're vaccinated. But teachers, administration, staff in the school, even if they're vaccinated, the formal recommendation is that they mask 100% of the time that they're in that school, because this is a different variant and it's much more contagious. And even if you're vaccinated, if you have asymptomatic COVID, you can spread it to others. You're less likely to spread it, but it still can happen. It's been documented. And so we want to make sure that teachers and schools are doing everything they can to keep, Delta variant from spreading. And the way to do that is vaccinated or unvaccinated, that it's universal masking indoors.
So now you have a very special interest in masking. So for all of you all who don't know, Dr. Brown and her partners actually have a company called littleliesppe.com. Littleliesppe.com. Just go ahead and log on there if you all will, and get your mask. Tell us a little about something about littleliesppe.com and how that came to be, Samira.
And early in the pandemic, last spring, one of my good friends from medical school called me, and she had a child who was, asthmatic. He was taking the bus or the train to school in New York City. And it was just as that uptick was starting to happen in New York. And we were ordering all kinds of things for him to try to get medical grade PPE to him from across the world, mostly. Just because we didn't have as much availability here in the US, because we really had not had to deal with a respiratory virus like this. And as you know, supply was a huge problem in the beginning of the pandemic. Not that it isn't today, but significantly less of a problem in terms of supply. And then it really came to us because what we got was low quality, or it wasn't actually certified. There was no idea what the filtration level was. We said we really could do this ourselves. We know exactly how to put this together. We know what kind of testing, masks need to have. And so we basically did a 3-ply ASTM3, which is a medical grade mask that we would use, what we call a surgical mask. And we made it in sizes for kids and adults, because we know that everybody in the family needs to be protected. And then we also made what we call our LL95, which is an American-made KN95 equivalent. So currently, the US doesn't actually do N95s with children, but the biggest difference between an N95 and a KN95 is just ear loops versus a head strap. But the important piece about this is when you're trying to keep out those tiny little viral droplets, you need to have a high filtration level. And so our PFE, or our particulate filtration efficiency, is greater than 99%. And so it's really important, if you're going to pick up a mask to use, that you know what that filtration is, so that you're not taking risks that you wouldn't.
So show us a couple examples. I know you got some there with you. Just show us a couple and tell us what goodies you got there with you today.
Absolutely. So these are our 3-ply ASTM, and I'm sure everybody has seen these styles of masks, and you can see we have some fun prints for kids, because as we know, kids sometimes need something extra.
Yeah, they do.
Get them encouraged to put a mask on, right? And
so
even
now those are the ones you just showed. Those are level 3 surgical masks.
Yeah,
I could wear that in the operating. Yeah, I wear those in the operating room just for the benefit of the crowd. And those are pediatric sizes. Is that correct?
Absolutely. And so we have a number of different designs, and we also have them in the solid colors for kids as well, and for adults. Even adults have told us, listen, I want this to match my outfit. And we're, even though matching is not at the top of our list of criteria, but I wanted to protect you, right? But I get it. I like to be matchy too, right? And then this is our LL95, right? So you can see we even have a denim, which is pretty popular, right? And so if you have a smaller face, as an adult, on our kid size sometimes will fit you as well. So everybody just kind of has to see. And all of them have this nice, nasal bridge wire as well. So you can make sure that it fits really tight and that it's snug, because that's exactly what you want. And what we find is that some kids who don't tolerate the surgical mask style, right? Something like this. Some kids who really don't like that feeling of it being all the way across their face do better in this, because it's only going to touch on the outsides, right? And so this is what, our LL95 is. So it's a KN95 equivalent, but it's all American made. And so the filter material that these masks are made out of is polypropylene. And so the important piece about polypropylene, as you know, Coop, right, it's got an electrostatic charge that sticks to those droplets and doesn't allow them to come through. So there are even additive benefits. So we were very specific with what we wanted to choose. And also made sure that they're non-toxic, that there's no fiberglass in the filters, right? All of these kinds of things, unfortunately, that we've seen, kind of with folks coming in with fraudulent, PPE. We want to have a trusted source that really is tested.
Yeah, I tell you, early on in the thing, I was getting, every Jack Jones in the world scammer lammer that you could imagine. Hey, Dr. Cooper, we got PPE. Yeah, right. Okay. So someone asked, it's littlelivesppe.com. I put it in the chat earlier before you all came on. I just put it in there again. Please go over there, get your adult bling bling colored mask. I will say, I've actually thought about that before. Got a little dressed up. I was like, man, I kind of look like a surgeon here. I wear this stuff all day, every day. Yeah. So like, I don't want to wear my surgical mask to, whatever.
Exactly. We've got different colors for it. We've got black, we've got gray, so you can match it up. I mean,
yeah, I was like, and I saw you I appreciate the samples that you sent me, and I have those here. And so yeah, I'll be wearing my bling bling with maybe I'll get a gray one for my little gray suit here. And check that out. So that's fantastic. So Samira, how's the business done? Let's talk about the business doing good, because I'm an entrepreneur as well.
The business is doing great. It's definitely a project of passion. I definitely never thought, if you had asked me 5 years ago if I would own a PPE company, it definitely would not have been on the list. But it was definitely something that we saw that there was a need, and also too for our community. We didn't want them to be in something with cloth, as folks put a bandana on or a gaiter, and some of those filter 10% of particles. Right? I wouldn't see a flu patient in a cloth mask. I don't think that that's good enough for myself. And I certainly don't think that it's good enough, for kids and families, especially when it comes to something that's harmful to them. So it's been really meaningful to do something like this during the pandemic. And the other piece that's been great is that we've been able to partner with homeless shelters in Texas, here in Georgia, and in New York as well, to donate PPE to families who are at higher risk. So it's really been, just really feel good moment for us in the pandemic, as much as you can have one, because I know it's been long for all of us, but we want you to know that we're here for you. These rates will come down, and the faster you mask up and the more people that get vaccinated, the faster this surge will come back down.
That's right. So we often take for granted, Samira, and I know you don't, because this is what you do, that kids don't really understand this stuff. So tell us how you educate the children on the necessity of masking, hand washing. Have the children been embracing that, do you think?
It depends on their age.
Yes, of course.
So we want to have a developmentally appropriate approach, depending on where they are. Some kids are very savvy, and sometimes it depends on how they are. Like I had a teenager come in last week, and we were talking about what to do, especially here in Georgia, right? It's been suggested, but not necessarily required in some schools of my patients who have come in. So we talk about, how are you going to deal with that if other kids are not masking, if your teacher is not masking? Are you going to have confidence to mask, regardless of what everybody else is doing to keep yourself safe? And this teenager, individually has a mother who's at home who's immunocompromised. And he said straight out, I'm going to mask 100% because I know that I need to do that to protect my family. Right. And then you have little kids where sometimes they're coming in for their well visit, and it's the first time they've had to, wear a mask because they are not back in school. They haven't necessarily been back in daycare, and it's on, off, on, off, on, off. And, the parent is constantly reminding, sometimes getting frustrated, and really engaging them in, you see Dr. Brown is wearing hers. You see mommy or daddy is wearing them. I always love to use an older sibling because oftentimes, whatever they're doing, this is what our little brother or sister wants to do,
Mm-hmm.
right?
Mm-hmm.
So you want to use all of that to your advantage and give a lot of positive praise and practice it at home before, they're back in school. But most kids, even kids who, have sensitivity with practice and with that encouragement, they definitely can wear it and they can wear it all day. The other piece about what you're choosing to mask with that impacts it, though, is whether it's breathable. So the other piece that we see is sometimes
Mm-hmm.
folks have a mask that's not actually breathable, right? So ours are medical grade, and medical grade masks, if you all don't know, you actually have to prove that you can inhale and exhale very easily through these materials because we potentially wear them all day. I mean, Coop, you do surgery in them.
Mm-hmm. Sure.
So
Right.
it's a crucial piece. So you definitely want to, practice with your kids at home and then potentially talk to other parents that are going to be, in your classroom if they're going to have a pod in school, talking about, is our pod going to just agree to mask even if the entire school is not, right? And oftentimes what you'll see is that, others may take your example, and be able to advocate even more. And certainly you're armed with the recommendations of the American Academy of Pediatrics and also with the CDC.
Yeah. So, it's one of the areas that, and one of the things that, schools, man, you and I talked a little bit before we came on live about the daycare. Oh my goodness. I mean, because those little ones, they're little people and they are exploring this world for the very first time. And man, what should parents demand or ask or investigate in terms of sending their having now to send their kids if they're going back to work or whatever to daycare? What's happening in the daycare scene now that parents can do? What things can they do to try to make themselves feel more comfortable with that situation?
Yeah, certainly under 2 years old, it's not safe to wear a mask. So all of those children, are definitely going to be at higher risk if they're indoors. So you definitely want to talk about, is their staff same as school? Are they vaccinated? Are they going to be, masking? Are they going to be testing, their staff to make sure that there are no, outbreaks? And really make sure too, right, that the other families are also doing things to protect their families, right? So it's really important that you're asking a lot of these questions ahead of time because sometimes folks unfortunately find out later. And also how they're going to notify you if there is an outbreak and what they're going to do if kids get sick. So they should have a plan. They should be able to tell you exactly what they're going to do and making sure that the teachers are not going from one room to the other because that too just increases the risk of the babies in that classroom if the staff is switching. So you want to make sure that they understand these protocols and that they're following them consistently. And they should be very readily available and open and not resistant, to your questions. And I always tell parents, trust your instinct. If it doesn't feel right, don't do it.
Yeah, intuition matters. There's no doubt about that. So where can parents get those guidelines? Are those a CDC website? Do you have them a link on your site in terms of the standards for daycare and potting and those kinds of things?
Yeah, so they can go to healthychildren.org. That's the American Academy of Pediatrics. There's also the Black Coalition Against COVID, so BC Against COVID.org. And also, of course, the CDC.gov also has those guidelines on there as well. We also have tips on our site as well. And you can always reach out to us. We're happy to help. And so definitely, engage other parents, other families, spread the word about what needs to be done, and don't be afraid to advocate, for your child and for your own community, because what we're doing to protect one child really impacts also their family and the whole rest of the community.
Let me pause for the cause. You all are hanging with Dr. Cooper. I really appreciate it. I got a lot of new faces and I know y'all are here just to see Dr. Brown, but that's okay. I'm glad you're here hanging with me this morning. And I hope you do come back because we always have a really interesting guest. And sometimes I just run my talking head for about an hour. But we're talking to Dr. SAMIRA Brown. She's a top doc and pediatrician in Metro Atlanta. Her contact information is in the top of the comments section. If you'd like to see her, have your child see her professionally, Dr. Ozita Cooper, thank you for checking in. And that's Dr. Derek Collier. How are you? Thank you for checking in as well. And also made an order, Patrice Brown Greer, PBG. You got some orders going into your website now.
That's great.
Samira. I don't get any kickbacks, you all. This is all just me talking. Okay, I don't get any kickbacks. But anyway, this has been Dr. Smith. Rhonda Smith just ordered some masks. So I really appreciate you all supporting our physicians, because we want to do everything that we can to support you and help you get through this thing. Samira, we've been talking a lot about COVID, but this is back to school. What should parents do? And I know COVID is just like overwhelming everything. What are some of don't forget the other check boxes. What should we be doing? There's some other check boxes in terms of safety for your children and health going back to school.
Right. No, I mean, I think one of the biggest check boxes that I think is underestimated is their emotional health, right? So what we have seen a huge impact during the pandemic is anxiety, depression. And oftentimes this presents differently in children. Oftentimes they can't tell you why it is that they can't sleep, why it is their tummy hurts, why they have a headache, why all of a sudden we're not doing well in school where it used to be fine, right? Or we don't want to do the activities that we used to, right? Mood all over the place. So you really want to think about preparing them to go back to school. Are they worried? They're hearing these stories, on the news. To reassure them that it's our job to keep them safe and that it's okay to feel any way that they feel. And we want to make sure that they have the tools to deal with those feelings in a healthy way. So I think really checking in with your kids about how they're feeling and ongoing to make sure that if they need extra supports, right, that we really are there and we're giving that to them. So I think that too has been, in a sense, a second pandemic that we've seen in pediatrics since the start.
Yeah, I often talk about that on the show, how little attention, quite frankly, I think, is paid to mental health at all ages. And certainly we know that is a really big deal in children. One of the things, Samira, just sort of back to COVID a little bit, that's been a little bit, I guess, if you will, anxiety provoking for me, is this idea of, or I just want to get your thoughts. A little political question here, and we do politics from time to time on here as well. Of requiring vaccines, and I think my friend Don Goins in the chat asked about testing, but requiring essential workers to be vaccinated, particularly if they're caring for people in hospital settings. Like I personally think we should. But what do you think about that? If not vaccination, then compelling testing on people who are taking care of our children and us in these sort of involuntary environments to some extent.
Yeah, I think that, testing is a huge piece of keeping things safe, in a large part because COVID is so asymptomatic. So whether you have symptoms or you don't, it's a great, piece to put into whether it's schools, health care systems, to test randomly whether folks have symptoms or not, because you're going to catch an outbreak hopefully before it spreads even wider, right? So in part because you can spread COVID for 2 weeks before you ever, present with symptoms, and sometimes you never do, right? And so testing definitely is something that we encourage all schools and all health systems to start. I think in terms of mandating vaccines, right? We've seen it already. We already have flu vaccine that's mandated in most health systems, right? And if you are not going to get the flu vaccine, you're mandated to wear a mask, right? And so there are ways to do that. And I think that we should be held to a higher standard, because if you have someone who's unvaccinated taking care of COVID patients and they spread it to someone else, that's something that's preventable.
Yeah, you're absolutely right. And, let me rephrase that. That's not a political question. That's a public health question. That is a question that just makes public health sense. So we need to move beyond that issue. So we've been on, you all have been hanging with Dr. Cooper. You've been on with my guest, Dr. Samira Brown, and she's been talking about returning to school, children, and COVID-19. Any other pressing questions out there in the chat before I let Dr. Brown get out of here and get on with her Sunday? Dr. Brown, give us a wrap up. Tell us how we can stay safe. Give us some parting shots, some things that we can take and put in our back pocket, in our memory bank, that's going to help us stay safe and well.
I mean, certainly the first thing that I'm going to say is to vax up, right? 12 years and older. We know the vaccine is safe. There have been over 7 million children, 12 to 17, who've gotten this Pfizer vaccine. We know that it's safe to give. It's effective. It actually works. And we know that it's going to save lives. And you need to start masking up if you're indoors, especially if you're living in an area with higher rates and also low vaccination rates. And certainly everyone who's back in school, 2 years and up, universal indoor masking. So combine all of those preventative measures with masking up and getting vaccinated. And if your child gets sick, if you get exposed, please, please, please call your pediatrician. And think about, some people have missed their well visits. Some people are behind on routine vaccinations just due to the pandemic. So make sure that your child also is up to date with their routine immunizations as well.
Yeah, that's great. So I do want to ask you one more question. Telemedicine in pediatrics and telehealth, have you been able to utilize that? Has that been helpful, or is it a hindrance? Or I would imagine it's a little difficult because these little kids are growing. They're not kind of static adults, big fatties like myself. Has that been something you've been able to tap into during this pandemic?
Yeah, I've been doing telehealth for quite a while, even prior to the pandemic. I actually love telehealth with kids because you can see what their home life is like. And honestly, it's pretty easy to engage them because they love those screens, plus and minuses to this, right?
Meeting them where they are on screen.
Absolutely. Yeah. And usually the other sibs want to come into their room and say hi to Dr. Brown, right? And so
I love it.
We're getting little side visits in as well, right? And then we can also see grandma, right? And we can talk about different exposures that they might be getting in their home that you didn't realize before. So telehealth is a great, option. And obviously there are only certain things that are going to qualify for telehealth, but it's great for things like if you have a rash or, something simple that we can just see on screen if we can see it well enough. And certainly in terms of advice, whether it's something about anxiety or depression, a lot of times you can do that initial visit through telehealth, especially if they need to talk to you immediately. And then of course you can always do a follow-up, physical exam in the office, which we do on a regular basis. So it's been really helpful during the pandemic.
That's fantastic. Well, ladies and gentlemen, this has been another fantastic hanging with Dr. Cooper. I want to thank my guest, Dr. Samira Brown, for once again joining us and giving us some absolutely fantastic information. You can reach Dr. Brown at littleliesppe.com. That is her website for PPE. This is legitimate, standard surgical grade, healthcare grade PPE for your children in particular, but also you have adult masks there as well. And they've got some nice colors and bling bling if you want to match with your beautiful, like my wife just walked out in her beautiful red jumpsuit to go to church. So you can go to Little Eyes PPE and get your PPE today. If you want to connect with Dr. Brown, she is at Piedmont Pediatrics in Covington, Georgia, and her information and contact office number is in the top of the chat or the comment section of this broadcast. It'll be there and stay there for you as long as this is out there. So, Samira, I want to thank you once again for hanging with Dr. Cooper. This has been fantastic, and thank you for offering up so much wonderful information. I also want to thank you all out there who have been watching and supporting the show. I am back. I'm going to be live in 2 weeks. This is the first Sunday of the month. We come back on the third Sunday. We'll be live from the beach somewhere near Samira's neck of the woods, Martha's Vineyard. We'll be there for vacation. Yeah, so we'll be up your way in the next couple of weeks for a little bit.
You'll be up there in good company.
Yeah. So we're gonna have a good time. We're looking forward to it. Samira and all of my guests out there, thank you so much. I really appreciate it. Thank you all, and I will see you in 2 weeks. Bye bye.